This month is all about arthritis. We know that's inflammation in the joint. There are a lot of different types of arthritis, and we just really want to make sure that we stay in that rest and digest system when we are working with clients or maybe ourselves with arthritis. So we're going to talk about mountain pose, and we're going to make it a little bit easier by having a wider stance, right? If the base is wider, the pose is generally easier to do, depending on the pose. We're going to lift up through the arches, and putting a block here helps us to activate those hip adductors. It really makes us use those muscles because we have to hold the block there. So we're going to engage all the way up to our pelvic floor. We're going to we're going to lengthen, rather, the sacrum and the tailbone down, engaging the abdominal muscles, opening up the back. Now, if this is something that irritated the knees, we could do this in a seated position. We can also just bend the knees a little bit. We can open up the shoulders. If someone has arthritis in their hands, which is pretty common in the older generation, we can just kind of omit the hands and just let the palms relax and face forward here. So I'm still engaged in the pose. I'm just not pressing the palms forward like I generally would. Another nice modification is tree pose. So sometimes there's a lot of pain with arthritis. There can be. So to modify this, we're going to shift all of our weight to one side, and then we're going to lift the one leg straight up. Now we could be at a wall here. We're going to laterally rotate it and just place it on a block. This block could even be closer to the other foot. If you put it further away like this, it's going to be generally easier for balance. This is just a nice way to work on that hip flexion if you have someone who's really struggling with some arthritis of the hips, maybe the knee or the foot. The block is nice and soft. It's going to give a little bit more support than a blanket would. So it just opens up the hip, and then we come back to neutral, and then we could even just do this on the other side here. I feel like you could even just bring it up, but I would use a block because arthritis of the feet, motions like this can be challenging. So we would come here, lift, rotate to make it easy and accessible and hopefully pain-free.